Hello, everyone, and thank you again for joining us in the conversation about the transformation of mental health, the transformation of service provision, whatever it is that means that allows for there to be a more inclusive and equitable system of receiving and accepting services for individuals who want them and need them. And this has been a conversation we've been having on an ongoing basis about what this transformation would look like, some brainstorming ideas, opportunities for us to explore what is also happening for us in this process. What are the risks and benefits that we might be perceiving about ourselves in terms of even engaging in the conversation? And today, all of this leading to an eventual opportunity to have conversations on a wider scale with a larger group, so that we are able to really facilitate a new way of thinking about our current systems and what really is necessary in order for there to be any sort of sustainable, meaningful change in the system. And today, we've been using articles to facilitate these conversations. And today, we are going to be looking at a new article, as we have just completed the previous one, and this is about the ideas related to social work leadership. And it's a really interesting conversation to have. Particularly on Friday, we had our think tank, and it was really, when we took an opportunity to look at the WHO report, WHO, World Health Organization report, that focused on the transformation of mental health, and it was over a number of years. It was 2013 to 2030 in order to see these transformations take place. And what was very interesting is, as we were looking at the actual WHO report, everything about it sounded absolutely wonderful, and sounded very much about what it is that we have been talking about, what the essence of this transformation is, and then looking at the current systems, and then the follow-up reports of where we are now, and the needle not having moved much, if at all. And some of the things that indicated in there, we know have equal access to mental health services for all. And we know that there have been a lot of challenges and a lot of upset and a lot of concerns related to a universal healthcare system. So it becomes this really interesting conversation of what are some of the pros and cons and barriers to realizing what we all know to be needed, to be true, to be necessary in order for us to all be able to thrive in our communities. So today, what we're looking at is this crucial role of social work leadership. And so in all of these conversations, where does that then leave us? In these ideas of social work leadership, in these ideas of where exactly have we gone? Where has the needle moved? In 10 years, in over 10 years, where has the needle moved in terms of any kind of transformation, and what role have we as social workers played in that? So we're looking here, and we're going to just start off from here, where the beginning of this section, where it says, social work is a profession that plays a pivotal role in addressing some of society's most pressing challenges. Whether it's supporting vulnerable populations, advocating for social justice, or providing essential services, social workers are often at the forefront of positive change. At the heart of this profession lies the concept of social work leadership, a force that drives innovation, fosters collaboration, and empowers individuals and communities to thrive. And then it goes on to talk more about what the article is going to include. And so, it's the question, right? It's, these things are at the forefront of what it means to be a social worker. And it just makes me wonder about the grandness of it and the execution of that grandness. And the, and the sort of this, we talk often about how the system itself is siloed, in terms of, somebody who has multiple needs, not being able to access the care that they need from in those multiple settings. And the challenges associated with that. And it makes me also wonder about whether or not there is a social work leadership that is siloed as well to a particular area of practice that somebody might be invested in, and then sort of the other areas become less important. And so it mimics if that is the case, it mimics the experiences of the people we serve, in that if it's not relevant to what I'm doing right now, then it's not relevant in the bigger picture, or I'll get to it at some point. And so it just becomes like a really interesting conversation for me anyway, in thinking about it, particularly in my own practice, of looking at systems and the implication of systems. Now, I worked with people who were justice involved. It impacted systems across all divides. However, there were a number of things I did not consider and I did not think about because they were not in my field of practice. And so where I might have been a leader in the area of advocacy for people who are justice involved, I was not thinking about my role as a leader for geriatric mental health, or children and adolescents, or college mental health, or any of the areas that weren't directly touched on a day-to-day basis, or families and the needs of families, because I worked with individuals. And so I think it really allows us to look at how we have been operating in these different systems from potentially leadership, where leadership is also siloed. And is that okay? Is it okay for leadership to be siloed? And if it is, then how do we then bring together some of those elements or some of those leaders so that we really are thinking about the transformation of mental health outside of the silo and in a much more inclusive way? So those are my thoughts for today. I'd love to hear about what comes up for you. Please feel free to post in the chat and let us know, where you see yourself in leadership, and if these experience of the siloing of practice mimics the siloing of leadership, and what role you're in or what role you want to take in that. So I look forward to hearing from you, and have a wonderful rest of your day.